Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Every 11 seconds, an older adult is rushed to the emergency room because of a fall. Falls are the leading cause of fatal and non-fatal injuries for older Americans. Not only are falls dangerous, they're scary, leading to a fear of falling that causes seniors to become less active and withdrawn. But there's good news. Most falls can be prevented, and that's what we're going to talk about today. I'm your host, Beth Brown. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. Welcome back. Even though 1 in every 3 Americans over the age of 65 falls each year, most people do not tell their doctors they fell. But did you know your doctor can actually help keep you from falling while also helping you stay healthy, active, and independent? Dr. Roman Hendrickson joins us this morning to talk about how your doctor could be a great resource for your personal fall prevention. Thanks for being with us this morning.
Thank you.
So this probably seems like an obvious question, but can you start out by talking about what a fall really is so that people know when they should tell their doctor when they fall?
Well, really, it's any unplanned contact with a surface that's not the result of a push or a pull, not the result of passing out or something of that nature. So you don't have to actually crash on the floor, but if you just kind of lose your balance and fall to one side, that would count as a fall.
Like to a chair or something too, not just...
Correct.
Okay, great. And there are physical reasons why people might be more at risk of falling. Can you talk about some of those conditions or ailments that people might have that could put them at risk?
Right. The most common that we see is probably physical inactivity, because with the lack of physical activity, people's muscles become weaker, they're less responsive. You can, in association with that, develop less balance. These kind of things, if we can identify them, then we can send them to the physical therapist, and the physical therapist can work with them. In addition to that, things that people don't always think about are vision problems. People who have bifocals are much more likely to, at least when they initially get them, to misjudge surfaces and then fall. People with cataracts, decreased vision in general, decreased hearing. Hearing can be a problem as well because people are so distracted by trying to concentrate on what they're not hearing that they may fall. Joint problems. People have a joint that they can't trust and their posture changes. Neuropathies where their sensation is different. And nutrition. Nutrition's a big one that, if you don't drink enough fluids, you can get lightheaded, you can get weak. If your vitamins and minerals are off, your muscles don't work as well. And what people a lot of times forget is that as we age, all of us, our reaction time gets not as good.
Sure.
So if you lose your balance, you can't recover as quickly. And if your muscles don't cooperate, you're really in bigger trouble.
And so what can happen after somebody falls?
Well, you can obviously fall and fracture a bone. You can have a strain or a sprain. You could have an injury where you strike your head, have concussion or other brain injuries. You can have tremendous expenses, obviously, if you have an injury. You can have death. About 1 every 19 or 20 minutes in the United States, an older person falls and dies as the result of the falls. There's a significant number of serious injuries from what would seem to be insignificant falls.
Okay, and so when should someone talk to their doctor about either a fall they've had or fall prevention?
Well, I think that it's important to talk to the doctor if you think that your balance is starting to not be at the level that you're used to or you perceive that it's changed. If you're having trouble getting up out of the chair or you fall back into the chair, if you almost fall or if you do fall, all of those things can tip us off that there's things we need to evaluate.
And so what about fall prevention? Let's say, for example, someone is going to just their physical every year or something like that. How would they bring that up to their doctor if it's not why they went? I know sometimes people are a little bit uneasy to kind of just bring things up. Do you have any suggestions on how they can approach that subject?
I think people a lot of times will address it by saying my balance is off. I find that I'm not as steady as I used to. And then when you pursue that avenue of questioning, you'll find that they actually had falls. And that's why they perceive their balance is off. Or they can say, you know, I've had a couple of episodes in the middle of the night where I lost my footing. You know, they don't have to come out and say I fell, I did things that would make you think that I'm weak or frail. But I think just addressing the issue that, you know, they're unsure. And fear of falling can be just as crippling as falling. People who are afraid they're going to fall start to limit their activities. They don't go out of the house. They don't want to socialize as much. So bringing it up, discussing it, trying to get something addressed to that problem, that concern is important.
And so if they do bring it up with their doctor, what can a doctor do to help them with fall prevention or make sure that they're not fearful or they don't get hurt?
If we identify and think that there's a problem with their balance or their muscles and how they're responding to a situation, a lot of times we can refer them over to physical therapy for evaluation, exercises, various interventions. We can inquire as to what their diet is like, how much fluid is going in. There are certain medical conditions that may contribute to it, so we can potentially evaluate for those. Medications, of course, are a big issue. A lot of the things that we use for one problem can create another. And especially if you've added a new medicine, at the time you add a new medicine is the time when you're most likely to see changes. If people don't tell us these things, we may not be aware that those problems exist.
And if it is something with vision or hearing, should a person talk to their primary care physician about those kind of things, or should they wait and see a specialist, or what would you recommend there?
Well, if there's a concern about hearing or vision, I mean, we may be able to do a screen to see whether it's a valid concern. Sometimes people feel like they have a hearing problem. Wives a lot of times will question whether their husbands are deaf. Turns out they're usually not. Vision, we can screen for as well. And the ones that it's a valid concern, we can help make sure that the person gets to the right person to be evaluated.
Perfect. Thank you so much for all that information. Coming up next, can what's in your medicine cabinet put you at a risk for a fall? Some medications are also a big factor in causing falls, as Dr. Hendrickson said. Find out which ones right after this.